As in my previous video, I have discussed about the sideroblastic anemia. In this video, I'll be saying about the anemia of chronic disease. All this comes under the microcytic hypochromic anemia. That is, you can remember microcytic anemia as a TAILS, TAILNS. T for thalassemia, I iron deficiency anemia, A anemia of chronic disease, L for lead poisoning, and S for sideroblastic anemia. This lead poisoning is also the reason for the sideroblastic anemia. This I have discussed in my previous video. Now I'm coming for the anemia of chronic disease. It is also microcytic anemia. Microcytic anemia, hypochromic anemia, is also already said. The size of the cells will be less than nucleus of small lymphocytes. If this is a nucleus of small lymphocyte, that will be less than that. And hypochromic, usually RBC will be 1/3 pallor. If more than 1/3 pallor is there, then central 1/3 pallor, this is called hypochromic anemia. This is anemia of chronic disease because anemia is causing because of any chronic disease like bleeding in the GIT and all those. Any chronic inflammatory conditions comes under anemia. Autoimmune disorders, because autoimmune disorders also causes this anemia of chronic disease, because in this condition also there will be inflammatory cells. Autoimmune disorder most commonly occurs in the female, so female are more prone, and in cancerous conditions. These are acute inflammatory conditions where you can see anemia. Most common anemia is in hospitalized patients, because any chronic inflammatory conditions procedures produces acute phase reactant proteins, that is hepcidin. Hepcidin is produced from the liver. Liver produces hepcidin. What this hepcidin do means, it decreases erythropoietin directly, so there will be production, RBC production will be, erythropoiesis will be decreased, so there will be anemia. And this hepcidin also decreases serum iron level. If iron is not there, the synthesis of hemoglobin is not possible, so there will be anemia. And if iron it also hinders the iron absorption, so there will be anemia. And it also sequesters the hepatocytes, because all iron will go and accumulate in the liver cells, that is hepatocytes. There won't be any free iron available for the erythropoiesis. So hepcidin, in many ways it decreases the production of RBC, so it causes anemia. This hepcidin is released during the acute chronic inflammatory conditions such as cancers, autoimmune disorders, all those. Then peripheral sphere, most of the time we see normocytic anemia. Even though we classify under microcytic hypochromic anemia, most of the time it will be normocytic anemia. The lab findings will be, because this iron absorption is decreased, but iron is sequestered in the cells, so ferritin, that is storage form, will be increased. If storage form is increased, then the total binding capacity will be decreased, so absorption will be decreased. And serum iron is also decreased, because it's not absorbing, so there won't be in the blood. It is everything is going and sequestering in the hepatocytes, so the storage form is increased, but serum iron is decreased. And if serum iron is decreased, obviously percentage saturation in the serum is also decreased, so this saturation is also decreased. Free erythrocytes for porphyrin is increased. I already told in my previous video that for the synthesis of hemoglobin, the components of hemoglobin is heme and globin. Globin has alpha 2 chain and beta 2 chain, and whereas heme has iron and protoporphyrin. If iron is not there, protoporphyrin is not utilized for the synthesis of hemoglobin, so protoporphyrin level will be increased because iron is not absorbed. Iron is not utilized for the hemoglobin synthesis. This is all about anemia of chronic disease. If you find this video helpful, please do like, share, and subscribe to my channel. And if you have any suggestions, let me know in the comment section. Thank you.